हेलो डियर फ्रेंड्स, आज हम डिस्कस करेंगे मेंटल हेल्थ डिसऑर्डर्स। फर्स्ट इज ऑर्गेनिक डिसऑर्डर। द मोस्ट कॉमन यूज्ड फार्माकोथेरेपी फॉर delirium is haloperidol. Dementia is a chronic organic disorder leading to impairment of higher mental functions but no impairment in consciousness. It occurs due to decreased level of acetylcholine mainly. Risk factors of dementia include old age, family history, low education, female, sex, etc. But the most common cause of dementia is Alzheimer's disease. Priority nursing interventions for elderly patients is measures for fall prevention, as elderly patients have slower reflexes, decreasing ability to adapt to new environment and balance issue leading to fall. Dementia can be divided into cortical, subcortical and mixed type of dementia. In cortical dementia, diseases like Alzheimer's disease, Pick's disease, Jacob diseases are included. In subcortical dementia, Parkinson's disease, multiple sclerosis, Wilson's disease and HIV dementia are included. In mixed type vascular dementia, neurosyphilis, etc. are included. Eating disorder. Anorexia nervosa and bulimia nervosa are two types of eating disorder common among female gender at adolescent age. Both of these disorders are characterized by the intensive fear of gaining weight, but the difference among the two is that in anorexia nervosa, people starve themselves to the extent that may lead to malnourishment, whereas in bulimia nervosa, people do binge eating followed by purging. Patients with anorexia nervosa suffer from tachycardia, hypotension and hypothermia. Sleep disorder. Sleep cycles are controlled by the suprachiasmatic nucleus. Sleep can be measured by types of brain waves that occur during the stage of sleep activity. Stage 0, alpha rhythm. Stage 1, beta rhythm. Stage 2, theta rhythm. Stage 3, delta rhythm. Sleep cycle generally consists rapid eye movement and non-rapid eye movement sleep. Rapid eye movement, also known as rapid eye movement sleep, occur in beta rhythm. Dreams occur during rapid eye movement sleep. In some patients, bruxism occurs in stage 2. Narcolepsy is a disorder characterized by excessive daytime sleepiness, often disturbed night time sleep and disturbance in the rapid eye movement sleep. Insomnia is difficulty in initiating and maintaining sleep. Sleep apnea is defined as the cessation of airflow at the nostrils for 10 seconds or longer. Somnambulism is walking in sleep. Child psychology. New name for mental retardation according to American Association of Mental Retardation is intellectual disability. Normal intelligence level is 90 to 109. It can be calculated as mental age upon chronological age into 100. As per the level of intelligence level, mental retardation can be divided into mild, moderate and severe. Mild mental retardation is when the level of IQ is 50 to 69. Moderate mental retardation is when the level of IQ is 35 to 49. Severe mental retardation is when the level of IQ is 20 to 34 and profound condition is considered below 20. Autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interactions and communication. It is also characterized by restricted, repetitive pattern of behavior, interest and activity. PANDA stands for Pediatric Autoimmune Neuropsychiatric Disorder associated with streptococcal infection. It is seen in children when obsessive compulsive disorder, tic disorders or both suddenly appear following a streptococcal infection such as strep throat or scarlet fever. Neurotic stress related and somatoform disorder. Resilience is a process of adapting well in the face of adversity, trauma, tragedy, threats or significant source of stress. Some people, due to this mental ability, overcome a stressful condition, whereas some end up in crisis. Some examples of neurotic stress-related disorders are anxiety disorder, phobia, obsessive compulsive disorder, post-traumatic stress disorder, adjustment disorder, and dissociative disorder. Selective mutism is a form of anxiety disorder in which a person who is normally capable of speech cannot speak in a specific situation or to certain people. Somatoform disorder are a group of psychological disorders in which a patient experiences physical symptoms that are inconsistent with or cannot be fully explained by any general medical condition. Dissociative disorders are conditions which involve disruptions or breakdown of memory, awareness, identity, or perception. Dissociative disorder is also known as conversion disorder. Previously, it was known as hysteria. Labile indifference refers to an apparent lack of concern shown by some patients towards their symptoms. It is usually seen in conversion disorder. Post-traumatic disorder is also a type of neurotic stress-related disorder that occurs due to any type of severe trauma in an individual. To diagnose post-traumatic stress disorder, patient must have persistent remembering or reliving of the stressor, intrusive flashback, vivid memories, and stress when exposed to similar circumstances. Calmly reorient the patient to current situation is the nursing intervention in patients with post-traumatic stress disorder. Phobic disorder is an extreme and irrational fear of simple things or social situations. There can be different types of phobia as follows: agoraphobia, fear of open spaces; claustrophobia, fear of closed places; acrophobia, fear of height; pyrophobia, fear of fire; algophobia, fear of pain. Obsessive compulsive disorders stand for obsessive compulsive disorder. It is a mental disorder characterized by uncontrollable recurring thoughts known as obsession and compulsion behavior to repeat an activity consistently to relieve anxiety generated by obsession. Exposure response prevention therapy is a type of cognitive behavioral therapy which is very effective in the treatment of obsessive compulsive disorder. Also, medications such as antidepressant and anxiolytics are also found to be effective in treatment OCDs. The 5 broad personality traits are openness, consciousness, extraversion, agreeableness, and neuroticism. Personality disorders are divided in 3 main clusters: cluster A, cluster B, and cluster C. Schizotypal personality disorder is a first cluster, and cluster B antisocial personality. Cluster C is a avoidant personality disorders, anxious avoidant personality disorders. Obsessive compulsive personality disorder is also known as anarchistic personality disorder. According to American Psychiatric Association, depersonalization is the most commonly comorbid with major depressive disorder, anxiety, and personality disorder. Thank you.